Hello and welcome back to our channel. Suicide is a complex and sensitive topic that can be difficult to talk about, but it's important to understand the facts about suicide to prevent it. Today, I'll be providing you with some psychoeducation on suicide, which can help you recognize the signs and risk factors and support someone who may be struggling. Suicide is the act of taking one's own life intentionally. It is a serious public health issue that affects individuals and communities worldwide. It is important to understand some of the common risk factors that can increase the chances that someone may have thoughts of suicide or attempt suicide. Some common risk factors for suicide include mental health conditions. People with mental health conditions, such as depression, bipolar disorder, and schizophrenia, have a higher risk of suicide than those without mental health conditions. Substance abuse, drug and alcohol abuse can increase the risk of suicide. Previous suicide attempts. Someone who has attempted suicide before is at a higher risk of attempting suicide again. Family history of suicide. A family history of suicide can increase the risk of suicide. History of trauma or abuse. Traumatic life events, such as physical or sexual abuse, can increase the risk of suicide. Chronic pain or medical illness. Chronic pain or medical illness can increase the risk of suicide, especially if the condition is disabling or terminal. Social isolation or lack of social support. People who feel disconnected from others and lack social support are at a higher risk of suicide. Warning signs or behaviors or actions that may indicate that someone is at risk of suicide. It's important to recognize these warning signs and take them seriously. Some common warning signs for suicide include talking about wanting to die or kill oneself. This can include statements such as "I wish I was dead" or "I'm better off dead." Making plans or preparations for suicide. This can include giving away possessions, researching suicide methods, or writing a suicide note. Expressing feelings of hopelessness or being trapped. This can include statements such as "there's no way out" or "I'm stuck." Increasing substance abuse. Someone who is using drugs or alcohol more frequently or in larger amounts may be at a higher risk of suicide. Withdrawing from social activities and relationships. Someone who is isolating themselves and avoiding social interactions may be at a higher risk of suicide. Giving away possessions or saying goodbye. Someone who is giving away prized possessions or saying goodbye to loved ones may be at a higher risk of suicide. It's important to note that not everyone who is experiencing suicidal thoughts or behaviors will show these warning signs. However, if you notice these warning signs in yourself or someone else, it's important to take action and seek help. You can contact a crisis hotline, speak with a mental health professional, or encourage the person to seek help. Protective factors are factors that can help reduce the risk of suicide. It's important to note that having protective factors does not guarantee that someone will not experience suicidal thoughts or behaviors. These factors can include strong support network. Having a strong support network, such as family and friends, can help reduce the risk of suicide. Positive coping skills. Having positive coping skills, such as exercise, meditation, or journaling, can help reduce the risk of suicide. Access to mental health care. Access to mental health care, such as therapy or medication, can help reduce the risk of suicide. Connectedness to community. Feeling connected to a community, such as a religious group or volunteer organization, can help reduce the risk of suicide. Sense of purpose. Having a sense of purpose, such as a job or a hobby, can help reduce the risk of suicide. Hope for the future. Feeling hopeful about the future can help reduce the risk of suicide. If you suspect that someone you know may be suicidal, it's important to take action. Here are some steps you can take. Start a conversation. If you're concerned that someone may be suicidal, it's important to start a conversation with them in a non-judgmental and supportive way. Let them know that you care and that you're there to support them. Listen actively. Encourage the person to talk about how they're feeling, and listen actively without judgment. Let them know that you're there to support them and that you're taking their thoughts and feelings seriously. Assess their risk. It's important to assess the person's risk of suicide. Ask them directly if they are thinking about suicide, and if they have a plan or means to carry it out. If the person has a plan or means, seek immediate help from a crisis hotline, mental health professional, or emergency services. Offer support and encouragement. Let the person know that you're there to support them and that help is available. Encourage them to seek help from a mental health professional, such as a therapist or counselor. Offer to help them make an appointment or accompany them to their appointment. Keep in touch. It's important to check in with the person regularly and let them know that you're still there to support them. Let them know that you care and that you're available to talk or listen if they need it. Supporting someone who may be suicidal can be emotionally challenging. It's important to practice self-care and take care of your own mental well-being. This can include seeking support from friends or a mental health professional, practicing relaxation techniques, and taking time for yourself. Remember that your support and care can make a significant difference in someone's life. Thank you for your kindness and willingness to help someone in need. Suicide is a serious issue, but there is hope. By understanding the risk factors and warning signs for suicide, promoting protective factors, and providing support to those who may be struggling, we can work together to prevent suicide. Remember, suicide prevention is everyone's responsibility, and taking action can make a difference. Thank you for tuning in, and I hope you found this information helpful. Take care and see you in our next video.